What is the purpose of the head tilt chin lift maneuver? To open the airway and allow for effective breathing. When should a nasopharyngeal airway, or NPA, be used? When the oral airway is ineffective or contraindicated, such as in suspected head or neck injuries. What is the compression to breath ratio for adult CPR? 30:2. Where should chest compressions be performed? In the center of the chest, over the sternum. What is the rate of chest compressions during CPR? At least 100 compressions per minute. What does AED stand for? Automated external defibrillator. When should an AED be used? In cases of sudden cardiac arrest. What are the steps for using an AED? Power on the AED. Attach the electrode pads. Follow the AED's prompts. What is the first step in a scene assessment? Ensure the scene is safe. What does the acronym AVPU stand for in assessing a patient's level of consciousness? Alert, verbal, painful, unresponsive. Additional questions. What is the difference between a cardiac arrest and a heart attack? A cardiac arrest is when the heart stops beating, while a heart attack is when blood flow to the heart is blocked. When should you call 911 for a suspected stroke? Immediately, even if symptoms improve. Additional BLS questions and answers. Airway management. What is the difference between a patent airway and an obstructed airway? A patent airway is clear and allows for effective breathing, while an obstructed airway is blocked, preventing air from passing through. When should a jaw thrust maneuver be used? In cases of suspected head or neck injuries, to avoid further damage to the cervical spine. CPR. What is the compression depth for adult CPR? At least 2 inches or 5 centimeters. What is the correct hand placement for chest compressions? 2 hands placed on top of each other in the center of the chest over the sternum. What is the purpose of rescue breaths? To provide oxygen to the patient's lungs. AED. What is the purpose of the defibrillation shock? To reset the heart's rhythm. What should be done if the AED indicates no shock advised? Continue CPR until the AED gives a different prompt. How often should the AED be checked for battery life and electrode pad expiration? Monthly. Scene assessment. What does the acronym CAB stand for in the BLS sequence? Chest compressions, airway, breathing. What are the signs and symptoms of a stroke? Sudden numbness or weakness, especially on one side of the body. Sudden confusion. Trouble speaking or understanding. Sudden trouble seeing in one or both eyes. Sudden severe headache with no known cause. And sudden dizziness or loss of balance or coordination. When should you perform CPR on a person who is unresponsive and not breathing? Immediately.